When you imagine giving birth, you probably picture a hospital room, monitors beeping, nurses moving quickly, and a doctor walking in right before the pushing starts. Most people assume that's just how it goes. What we aren't told is just how many interventions have become routine and how each one silently stacks on top of the other until what should have been a physiologic process becomes a medicalized cascade. Take Pitocin. It's the synthetic version of oxytocin, the hormone your body naturally releases to start and strengthen contractions. In hospitals, Pitocin is used to induce or speed up labor. But what no one tells you is that Pitocin contractions are often stronger, more painful, and more overwhelming than natural ones, which then increases the chances of wanting or needing an epidural. The epidural brings relief, but it also limits mobility, often slows labor, and can affect the baby's positioning. So next comes the fetal monitor, IV fluids, maybe a catheter. And if things don't progress fast enough, now we're talking about breaking your water. If labor still doesn't move the way they want it to, a C-section might be next. This domino effect has a name, the cascade of interventions. And it's not a rare situation, it's the norm. According to the CDC, 1 in 3 births in the US ends in a C-section, many of which begin with something as simple as a scheduled induction. And when women say, I felt like things spiraled or I didn't feel in control, this is usually why. Not because they failed, but because the system doesn't pause, it just pushes. Let's look at the data. When interventions like Pitocin, epidurals, and labor inductions become routine, the statistics show a clear pattern: increased rates of C-sections, longer labors, and more complications. Research from the World Health Organization and multiple studies reveal that spontaneous physiologic births have far lower rates of intervention and better outcomes for both mother and baby. For example, women planning home births with experienced midwives have C-section rates often as low as 5–10% compared to the national hospital average hovering around 32%. That's a huge difference. It's not magic. It's the result of trusting the natural progression of labor, respecting the body's signals, and only intervening when medically necessary. Midwives support movement, hydration, emotional safety, and continuous one-on-one care. They don't rush labor or push schedules. This creates a space where hormones flow naturally, babies descend gently, and moms feel more in control. And that control matters because feeling safe and supported lowers stress hormones that can stall labor or affect breastfeeding. When women choose home birth, they often report feeling more empowered, more connected to their bodies, and more confident in their ability to birth without unnecessary interference. That doesn't mean every home birth is perfect or without risks, but it does mean the approach is fundamentally different. Less intervention, more respect, more trust. And those differences add up. They mean healthier recoveries, more positive birth experiences, and babies who often breastfeed more easily in the first hours. Let's unpack some of the most common interventions you'll hear about: epidurals, Pitocin, and C-sections. The epidural is often called the gold standard for pain relief in hospital births. And it works, it numbs the lower body, eases pain, and allows some rest during intense labor. But it also comes with trade-offs. Epidurals can lower your blood pressure, slow contractions, and make it harder to push effectively. That means labor often lasts longer, and many women end up needing more interventions, like assisted deliveries with forceps or vacuum, or even cesareans. Pitocin, the synthetic hormone used to induce or augment labor, can cause contractions that are more intense and less natural, which can stress both mother and baby. This often creates a cycle. Stronger contractions lead to more pain, leading to more requests for epidurals, which then slows labor down again, and then there's the cesarean section. Once thought of as a rare emergency procedure, it's now a common surgery. 1 in 3 births in the US ends this way. While life-saving when truly needed, C-sections come with longer recovery times, higher risks in future pregnancies, and they can interrupt the natural bonding and breastfeeding process. In contrast, home birth midwives support you through natural coping techniques. from movement and positioning to hydrotherapy and continuous emotional support, helping you manage pain without unnecessary medication. This approach honors your body's rhythms, reduces the chances of cascading interventions, and often leads to more satisfying birth experiences. When you look beyond the statistics and procedures, what really stands out are the stories, the lived experiences of mothers who've walked both paths. Many share how hospital births left them feeling overwhelmed, powerless, or rushed, their bodies pushed to perform on a schedule not their own. The cascade of interventions can rob the birth of its intimacy and joy, turning what should be a sacred rite of passage into a clinical event. Home birth, on the other hand, offers something different: space. Space to listen to your body, to labor at your own pace, to make decisions with your support team who truly knows and trusts you. It's not a promise of perfection or zero risk, but a commitment to respect, autonomy, and gentler care. Families who choose home birth often describe feeling more connected to their babies from the first breath, more empowered as parents, and more healed in the weeks that follow. That connection, the feeling of being heard, held, and honored, is the true essence of birth. It's why so many choose to step outside the system's routines, even knowing the challenges and stigma they might face. Because birth is more than a medical event, it's a transformation, and it deserves to be met with trust, not fear, with respect, not routine,